Today we are going to be massaging the muscles of the face and the jaw. So we're going to start by warming up the muscles of the face. We're just going to start with doing some effleurage. So as the muscles warm up, we're going to use a little bit more pressure. And following the muscles of the jaw right up into the temples. So I'm doing a little bit of muscle stripping here. Getting right under the bone. So with the face and jaw massage, we want people to try to relax their jaw as much as possible. So what I tell my patients to do is just have their tongue hovering between the roof of their mouth and the base of their mouth, so their tongue is not touching the bottom of their mouth and it's not touching the roof of their mouth. And that's the most relaxed position for the jaw. So I'm just gonna rotate her head to the side and we're gonna do some muscle stripping through here. So we've got the masseter muscle here, and then we've got her lateral pterygoids, and then her temporalis muscle through here. So we're gonna muscle strip all of those muscles, and we're gonna start right below the joint here and slowly work our way down. And I'm reinforcing with my other finger over top. Some people get nervous that they're going to hit lymph nodes and glands, but you'll be able to feel the difference between an adhesion in the muscle and what a lymph node is. Muscle stripping with my thumb a little bit through here as well. And again, coming right up underneath the bone and down through the muscle. So I'm feeling for any adhesions and trigger points in the muscles, and I find by moving really slow through the muscles here, you can find teeny tiny little trigger points through here. So once I've finished muscle stripping all through here, I'm going to come down to the masseter muscle and massage through here. And we're gonna get underneath the jaw a tiny little bit. There's a muscle called digastric that goes underneath here. Underneath the jaw, and then it comes all the way back to just below the ear. It can be quite tender for people if they clench. Do you feel that?
Mm-hmm.
Okay. So what we're gonna do now is we're gonna try to get to the lateral pterygoid from the outside. So some people that have education in intraoral massage will go into the mouth to treat this, but I'm gonna show you a way to treat it from the outside. What I'm gonna get you to do is just open your mouth slightly so it's relaxed but open. Does that feel comfortable for you there? Okay. So then what I'm gonna do is I'm gonna find the border of the lateral pterygoid here, and it can be a little bit tender, so don't hesitate to let me know if it's too much pressure. So once I find the border of the lateral pterygoid, I'm gonna come up with my thumb to the top of her cheekbone, and then I'm gonna rotate my hand downwards to muscle strip. Are you doing okay with the pressure?
Mm-hmm.
Okay. It's intense, hey? Then we're gonna flush that out. Okay. So now what I'm gonna do is I'm gonna feel the joint here. So this is your TMJ. So whenever people talk about TMJ dysfunction, this is the area where they feel pain and discomfort, but all the muscles that we worked on so far contribute to that. Gently press on this joint, and I'm gonna get you to open and close, Tanya, a couple times. Good, and again. So Tanya's got a little bit of popping actually when she opens up. So what we want to do here is we want to make it a little bit of a smoother movement. So basically what I'm gonna do here is I'm gonna put a little bit of upward pressure, and then when she opens her mouth, I'm gonna rotate my thumb down, and then I'm gonna muscle strip downwards. So go ahead and open and close. Good, we're gonna do that again, but I'm gonna get you to go really, really slow. So go ahead and open, 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 open. Slow, slow, slow. Good, and then slowly close. Okay, again, slow, super slow. Good, and close. Okay, we're gonna do a little bit of muscle stripping just below the TMJ. So we'll start by kind of assessing the joint. So she has a little bit of tenderness around the joint. So we are gonna work around the joint, but we're just gonna be really cautious around the TMJ. So we're gonna start just below and do some muscle stripping downwards. And again, raise your hand if anything's uncomfortable. And just a reminder that your tongue should be floating between the roof of your mouth and the bottom of your mouth. Good. And then once we're done there, we're gonna move just above the TMJ, and we're gonna muscle strip through here a little bit as well. With some people that didn't have jaw surgery, or they just have muscle tension that's causing the concern, you can guide the TMJ through range of motion, basically like a pin and stretch, to get the jaw to move more smoothly. But she had jaw surgery and completely changed the structure of the jaw itself. So doing muscle work through there isn't gonna change the fact that it's popping. So we're gonna do the same thing on this side. We're gonna muscle strip the TMJ joint towards the mouth.